as well as because initially I had wanted you guys to demonstrate your understanding by showing me some structures from scratch, but then I realized that a few of you, especially with the request that you were making through the class rep, I thought that might be too much to ask if I asked you to draw, for instance, the structure of saccharin and show me the important groups. You know, so I just thought, okay, what I would do is I'm going to give you partial structures which I expect you to complete, especially in terms of the important groups. So obviously for each topic that we looked at, for instance, when we looked at antiparasitics, we looked at certain compounds, and then we mentioned the important groups in those ones. For instance, we did talk about one particular agent. I think we talked about tinidazole, for instance, just as an example. And then we mentioned to say this particular group has this particular drug has certain important groups that are important for its activity. So without those particular groups, you might actually find that your drug is actually not working. So that's one of the aspects of it that I expected you to know. So even as you go through your material, just know that I think there's someone whose microphone is still on. You can just mute it. You can just mute yourself. Let's see who it is. Okay, so this one still on. That one still on as well. Okay, so just those two people. Yeah, so like I was saying, for those who are just joining in, most of the compounds that I'll bring, there will not be many. Like I said, it's not a very long test. It's quite a short one, just 50 minutes. So obviously I expect, if I give you section A with MCQs, I expect you to do that in probably 20, 25 minutes, and then you can concentrate on the structure. So like I was saying, for antiparasitics, I just gave an example of an imidazole, and then I mentioned to say these particular compounds have certain important groups in the structure itself. So those important groups, what I might do is I might bring a question. It might not necessarily be an imidazole, it could be any other compound. And then what I'll ask you to do is I'll ask you to complete that particular compound by showing me the important groups. Yeah, so by you showing me the important groups, what I'm basically trying to achieve is just to ensure that, I mean, it doesn't matter where you go. Like I keep saying, it doesn't matter where you go. You could be in academia, you could be in research, you could be working in a clinical setting. Yeah, so what you notice is that if you understand these particular compounds and the groups that actually make them work the way they work, then it makes your life easy in terms of product selection in a clinical setting. If you're working in academia or in a research facility, what you actually note is that you might still be able to design newer and better compounds because you actually understand which groups in the compound are important. So you have the scaffold. The scaffold, obviously, what we mean by a scaffold, for those of you who remember your medicinal chemistry or your organic chemistry. So the scaffold is mainly the main structure, which you actually decorate with the functional groups. So in this particular case, we have for instance, an imidazo, which is the nucleus of the compound. So an imidazo can actually function in any other way, but when you decorate the imidazo on obviously position 1, 2, 3, and 4, you actually end up with a compound that functions directly as an antiparasitic in the manner that we described it. So in this particular case, I might not expect you to draw the complete compound. What I'll just expect from you is to show me that you understand the groups in this compound that actually make the compound work the way it works. Yeah. So for those who are joining in who might not have logged in the beginning, I was just mentioning that the test will be quite short. And because the topics that we looked at, obviously, if we're going to do justice to the material, we're going to have a mammoth test, obviously, to end all tests. That will be a very, very long test, maybe 6 hours long. But in this case, since we're just having a synopsis of the material, we're going to have a 50-minute test that just sort of touches here and there to see whether you remember the structures of some of these compounds. The reason why I want you to, so we've got one section that just has compounds with no names. Okay, so I've done half the job for you. What I would expect you to do in that particular section is for you to identify the compound by name. And remember, the way I treat this, I don't know whether you guys have had any lectures with Dr. Kanyimba. I'm not sure. But what it is that for you guys, since you guys are pharmacists, and you claim obviously to know everything there is to know about drugs. So even the spellings of your drugs must be correct. Yeah, so if for instance, I'm giving you a section where I expect you to identify some compounds, I ask you to name those compounds, I expect you to give me the correct name and the correct spelling. So if the spelling is wrong, then unfortunately, I might, if I was going to give you 2 marks for that particular name, if you've really butchered it, you might not get a single mark for the name. So you have one section where it's just compounds, and I just want the name of the compound as well as what you actually use that compound to treat. So there is you now differentiating, distinguishing to say, I know the compound, I know this compound, I know what it's used for. So it's used for this. So I might ask you to say, okay, what do you use it for? It could be used to treat, let's say, just for argument's sake, malaria. Okay. So you give me the name of the compound. You also give me the name of what it actually treats. So that is one aspect of it. So simple, straightforward stuff as far as I'm concerned. Then I have one small mechanism in which a certain drug actually inhibits a certain enzyme. So this particular one is just basically a pathway. All the compounds are shown there. The only things that I've done is I've done certain steps. I've actually blanked them out, and I expect you to just tell me what you see in that particular compound. So for those of you who remember your medicinal chemistry very well, you still remember that from one step to another, if one enzyme is involved, it might change the substrate into a certain compound, and then certain things might be removed from your compound. For instance, it could be a decarboxylation in one step. The next step, it could be maybe a nitration, and so on and so forth. So the only thing I want you to do is, I've got one mechanism here. I basically want you to just fill in the blanks. I've got 4 simple blanks for you, which are fairly straightforward. For those of you who might have read the material in depth, you might be able to fill this in quite simply. So that is one. And then on the antimalarials, here you might actually have to do slightly more work, because these are very straightforward compounds. I think you remember we had those quinoline methanols, and then we have the 6 aminoquinolines as well. So those particular ones they're fairly straightforward. You know what the scaffold is, the nucleus of the compound. So what I expect from you there is to show me that you understand the differences between some of these compounds. I might ask you to say, there's this compound, let's say just for argument's sake, I might ask you to say quinine, for instance. I want you to show me the structure of quinine, and then maybe compare it to the structure of, let's say, hydroxychloroquine. So one might be a thing where you actually show me the whole thing, whilst the other one is where you just show me the missing pieces, which are actually quite important. Yeah, so that is on the antimalarials. And obviously on the antimalarials, here I just want you to be able to show me the differences, because you've got these vast groups of compounds, but then they're different. They might function the same way, but I want you to show me the differences. We know that the substituents in these particular compounds also impact on the ADME characteristics, absorption, metabolism, as well as adverse effect profiles. So for instance, why should you choose hydroxychloroquine over chloroquine? If you don't understand the structure, then it merely becomes a case of guesswork there. You'll be guessing or trying to remember from your pharmacology why, and probably they might not even explain there very intimately. They will list 100 side effects, but they won't tell you where they're coming from. So you showing me that you understand the differences between some of these compounds assures me that you know the genesis of these compounds. You know that some of them come from natural products, such as quinine, for example, and then others are synthetic, such as the chloroquines and so on. Yeah, so just that understanding, I think, is very important for you to be able to demonstrate. Yeah, then on the anti-cancers, I just have one question there. Unfortunately, we didn't have as much room in the test as we would have wanted, simply because we didn't want to burden you with too much material. Because obviously my thinking is this: I could ask you everything there is to ask about the material that we've actually looked at, but unfortunately that will not help you in any way in terms of your future practice. So all I can simply do is just see that you've understand the basics of the material by you demonstrating that you've actually read through and understand some of the important components that you might look at if you're in a clinical setting, like I was saying, or if you're in a research setting. So if you're in a clinical setting, you understand the structure, you understand the pharmacology, it becomes easy for you to select products that are useful to an individual product, an individual patient. Because you remember, Mr. Mutati actually always talks about individualization of a given treatment in biopharmacy. So obviously, how do you individualize a given treatment to a given patient if you don't understand the structure? So this is where we are. And then on antimalarials, further on antimalarials, I have a small figure where I want you to show me. So we've got different areas of the parasite with different organelles. And then what I simply want you to show me is where a given antimalarial drug actually functions in this particular case. So this is also quite important because, like we were saying, if you have an individual patient with a certain type of malaria, how do you select your drugs? If you don't know where this particular drug is going to end up acting, then what you're doing is, as the lawyers would say, is academic, because you are just going through the motions, but without understanding what you're actually doing. Yeah. Then I have one small mechanism where I just expect you to show me the end result of an activation of a certain compound. So even as you are looking at these ones, don't just look at them in passing. In our time, actually, we used to, in fact, this particular test, if I showed it to the person who taught me medicinal chemistry in fourth year, they'd probably laugh at the test because it's so basic. But you have a few, like this particular one, you're going to draw the structure from scratch. So I give you the starting material, a small metabolism, and then show me the active agent. So there you're going to draw. That's the only structure that you have where I expect you to draw the whole thing. But the rest of them are fairly straightforward. And then on the anti-cancers, I just have one MCQ and then one structure. So it's quite a large antibiotic, which I just want you to show me what is on what particular substituent. So you've got a large compound, and then this particular compound has a number of different drugs which have different substitutions. When you put, for instance, you put a methoxy group, it becomes one drug. You put a hydroxyl group, it becomes one drug. A hydrogen here changes it to another drug altogether. So this particular one, obviously, where you have your groups, I want you to be able to show me what is the end product of this particular compound. Yeah. So basically, that's what we have for the test. For those who joined in a bit late, I was just trying to emphasize the fact that I decided to adopt the American model, I think about 4 years ago, simply because your classes started growing much larger than they were before. So obviously it's only sustainable for me to just be able to test you to see that you understand the material by giving you very simple and basic MCQs with a few structures that you need to complete. So this one I think covers some straightforward MCQs, a few structures to complete, a few structures for you to name and give me a therapeutic use, and then just one, in fact, two simple mechanisms. So one is a mechanism through which an antiparasitic is activated to its active form, where it actually now begins to kill the parasite. So it's just a simple starting material is blank. Then all the steps are shown except the starting material, the second product, and the third important product are blank, and then the active agent that actually kills the parasite is also blank. But the rest of them are fairly straightforward. So anyone, like I was saying before, anyone who's actually read the material, read the book, will be able to remember, oh, this particular mechanism, I saw it there. This is the one that kills trypanosomiasis. So they'll be able to fill in the starting material. So just remember that where I give you a mechanism, some of the ones that you find in the book might be abbreviated, but for your sake, I think I expect you to show me the full structure of the given compound. Yeah, so those of you who joined in late, like I said, I had some technical difficulties to be able to print the test out for all of you 120. I hope that's the correct number. So we will postpone the test. I know those of you who are ready might be slightly disappointed, but for those of you who are not ready, you at least have another few days for you to prepare. Yeah, so I think in a nutshell, this is basically what I wanted to discuss with you guys, mainly the format of the test, as well as what it will encompass and the type of questions that you obviously expect. Unfortunately, I couldn't show you the material that I have in this particular tutorial, because it actually encompasses all the questions that you will have both in the test as well as in the final exam. So if I show you, I might be doing a disservice to you. After all, you're going to keep the papers that I give you after I mark them. Yeah. So just for your own preparation, most of these will come with blank spaces for you to fill in. So I don't expect anyone to come with paper. I just expect you to come with a pen and a pencil and a rubber. That's all. You can use the same pen paper as your rough work as well as for your answers, so that you don't lose any work. Yeah. So I think we'll probably end here. We'll meet for the test on Wednesday next week. Unfortunately, we won't be able to meet tomorrow due to the fact that I couldn't print out the test for everyone. Yeah, so we end here. I'll see you next week. Just prepare. Please don't read the notes. Read the book, because everything is coming from the book. I expect you to understand everything.